we are back. It is now 1:11 in the East and ready to roll. So I'd like to welcome everyone back to our second session, which will be the first of our panel sessions. Feeling a little bit like the Brady Bunch right now, looking around at everyone, which is good stuff. I apologize. I have not muted my other. There we go, right back at it. So thanks for putting up with the technical issue that I've had. So wow, that hour went pretty fast. Lots of great information and really delivered well, but begging the question of the next panel session coming up, which is how do we resume travel safely and continue to recover from COVID-19 outbreak in the travel insurance industry? We've got a panel that I will leave introductions to Warren Brown, who is our host. Over 17 years in the travel insurance marketplace. Many of you may recognize his face as the face of many of our videos, how to be a street smart traveler and so on and so forth. I'm going to turn it over to Warren's good hands to proceed with the panel. Take it away, Warren.
Thank you very much, Will, and welcome everyone. It's great to see you all here. I'm really excited about our panel. As Will said, we're looking at post-pandemic travel and how can we resume travel safely. We have Mira Jelic, John Spears, Dr. Joel Lockwood, and Paul Prendergast. And I thought I would, I'm not exactly sure where they're showing up on your screen, so I'll just give you an introduction. And I'll start with Mira Jelic, who is joining us from Toronto. Mira was the founder of Novus Health, which she operated for 10 years before selling it. Before starting Novus, she worked with the Ontario Medical Association and Minister of Health initiatives to bring electronic medical records to the province. She currently runs her own digital health consulting practice, working on a number of projects related to product innovation and improving member experience. Next, I will jump to Dr. Joel Lockwood, who also joins us from Toronto, where he wears a number of hats and scrubs. Joel is an emergency medicine and trauma team leader with St. Mike's Hospital and is an assistant professor with the University of Toronto and is also the chief medical officer with World Travel Protection. I'm sure many of you are already familiar with John Spears, who is vice president of sales and marketing at Global Excel. John is based out of the headquarters in Sherbrooke, Quebec, and in addition to his expertise in US healthcare and cost containment, John is often invited to speak on technology and innovation to international audiences. So this is exciting. And last but not least, we have Paul Prendergast, who joins us all the way from Ireland. So this is really a global panel. Paul is the founder and CEO of Blink Parametric, which delivers data-driven travel insurance solutions such as real-time payments for flight delays and disruptions. Blink was the only insurtech as part of the first cohort of the FCA Sandbox Safe Place to Innovate program and was acquired by the CPP Group in 2017. Blink has also been accepted to the Lloyd's Lab Innovation Accelerator program in 2020, focusing on parametric business interruption insurance. So thank you, everyone. I'm really excited about this panel. It's certainly in discussing with each of you on your own, we always came back to the example of, picturing someone travel. And John had given the example of, picture that it's your mother traveling. What would you want her to know? Well, I'm feeling a bit selfish today. So to quote one of my favorite chick flicks, forget your mom, choose me, pick me. I am just a boy standing in front of a panel asking them to let him travel. And if anyone in the audience can name the movie that's from, you can see Ryan Lee about a prize. But in all seriousness, why is it not as simple as getting back on a plane to an open destination and just getting insurance that covers COVID? And I think, Dr. Lockwood, I'll actually throw that to you.
Sure, thanks. Well, I mean, I think the first thing is, as everyone knows, we're in a once-in-a-lifetime global pandemic, something that none of us have ever seen in our lives. And Warren, while you look like a young, healthy guy, and I'm sure you have no health concerns, it's your mother you should be worrying about. And not just your own mother, but mothers and parents across the world, really. And we do know that international travel can be something that really drastically increases rates. And we've also seen that a lack of international travel in places like Victoria, Australia can make the rates of COVID plummet. So while international travel and withholding it isn't the only thing we need to do, or necessarily that in and of itself, it's really something that we need to be thinking mindfully of who should be traveling under what circumstances to keep the vulnerable people in our population safe.
Understood. Mira?
Well, I mean, I agree wholeheartedly. It is a really worrying time. We haven't seen anything quite like this. And I would say, having traveled at least domestically a few times since March, I've, it was a matter of knowing what to expect. I think that there are people who are traveling for pleasure, for work. People are curious, what will it be like? What do they need to do? I think we have to do a very good job about reassuring travelers and showing them what it might be like when they check into the hotel. What is it like being on the airplane? What sorts of measures will be taken? There's some great research in Canada, but also I want to point out in the US, many people have been asked this numerous times, what will it take to get you back? And people, overwhelmingly will say a vaccine. Well, we all know that that may take some time. In addition to a vaccine, well, better testing. So some of these medical measures, certainly having them in place will help alleviate some of the concerns that people have, but really we're looking at a real cultural change and shift. And I think that the longer that we go without the vaccine or the silver bullet test that can be conducted, within a span of 15 to 20 minutes where you get the result, there will be an inevitable change. People will have to get back to work and travel. I don't have a crystal ball in terms of when that'll be, but I think some of those important cultural measures are sort of, I know this is a digital health panel, but certainly what sorts of measures that we can take in North America and will you get on a cruise ship again if there isn't testing? I mean, these are all questions that I think we all have.
I definitely to explore. Paul, you're actually next on my screen. I'm not going in alphabetical order, but would you like to add?
Yeah, I think it's very interesting. And I think the primary concern is obviously public health and keeping people as safe as possible. Having said that, when the time is right, I think there's going to be an interesting period when people are feeling a little bit more comfortable about the public health situation, whether the numbers are reducing. And as an industry, I think we need to have a very clear plan of how we can provide peace of mind and certainty when people do want to get back on a plane. And as I mentioned, public health is definitely number one. But then comes after that is financial certainty. So if I book this flight, what happens if I get stuck in Jamaica? What happens if I get stuck in New York or London or Ireland or wherever that may be? So that's very real for people. And there's been lots of unhappy customers, lots of uncertainty about getting, whether it be refunds, etc. As I mentioned, public health, number one. Number two, as we encourage people to travel safely, people need to be certain that if things possibly go wrong and lockdown happens again suddenly or whatever that may be, that they're going to be treated. It's going to be able to get refunds back, that they're not going to get stuck somewhere they don't want to get stuck, etc., etc. So it's all about certainty, lots of transparency of communication to the traveler, because I think once they get a bit more comfortable on the public health issue, which is not right now, but in time to come, I think the next piece will be, well, am I happy spending a couple of $1,000s on this flight or this holiday? Because I don't know what's going to happen, and will I get looked after if things go wrong? Because in previous, as we all know, back in March and April, as an industry, lots of things I think could have been done better. So I think we need to improve as an industry going forward.
And John?
I personally couldn't agree more with what's been said. I think if I could talk about something overriding, Paul just mentioned it, and it's peace of mind. And it's peace of mind, I think, at all stages of the journey, from thinking about going somewhere and asking yourself, well, What's the health situation like at my destination? What are the rules and regulations around getting there? What happens when I'm there and I get sick? Just before getting on the plane and wondering, okay, the airline has now mandated a requirement that I get a test. It has to be done within 72 hours of departure. Where do I get the test done? What type of test do I need? Who's an accredited testing organization? So I think at each stage of the journey, the industry is going to have to provide consumers, both leisure travelers and business travelers, with peace of mind the whole way through. And until we get there, Mira mentioned this quite correctly. When there's vaccine, studies have shown, people say, when there's a vaccine, I'll travel again. But it's not even so much that. One of the big studies that just came out today from Travel Central here in Canada indicated that the 14-day quarantine on return was a major issue for travelers. Okay, very simple. So how do you get around the 14-day quarantine? Do you get tested when you come back or before you come back? And if that's the case, and you're down in Jamaica, Warren, where are you going to get tested down there? What's an accredited facility down there? And all of this information, and it's a mass of information available in various places, and it's constantly changing. I think for the consumer to travel, they're going to need peace of mind at every single stage of their journey. And once the industry as a whole can provide that, and I don't think there's any single organization providing all of that right now, but once that gets provided, people will get back on planes. People want to travel. There's no question about that, but they need that peace of mind before they get on the plane.
I fully agree with you, and I know that there's a part of the conversation I had with Dr. Lockwood, but just on the testing, is testing enough though? Because I mean, if I get tested and I get a negative result, do I then go maskless and topless on the beach in Jamaica? Is that enough? Like, how do we also combine ensuring that, yes, you have the test, but there's also another step that people still have to understand?
That's a good point, Warren. And people may know now that Alberta is now testing a new way of travelers coming in and seeing if a test-based approach can be appropriate. And that's using one of the antigen tests made by Abbott. The results come back in 15 minutes. It's readily available. It doesn't require a lab. It is cheaper. There are concerns about the accuracy of the test. We know it's not as accurate as the normal swabs that people get in things like hospitals. We don't know exactly how much less accurate it is because it hasn't been widely tested. But right now, Alberta is doing a pilot project in this, and I'm really interested to see how the results go. I do feel that the 14 days, quarantine and entering Canada it's definitely safe if people follow it, and it definitely will minimize, or if people follow it, make transmission almost zero. But I don't know if it's something that it's realistic long term. And certainly I could see that, if you wanted to go to Mexico for a week and come back and you have to quarantine in your own house 2 weeks, why that's going to turn off a lot of people. So I do think that there has been an unmet need in testing and getting people back, including things like using people's phones to help to get away from hotspot areas or to show that they've been doing the appropriate thing. But I'm not sure testing alone is enough. And a good example of that is the White House, right? We know that testing in of itself isn't going to be something that's going to prevent disease, and in fact, it might encourage it. If you're tested and you're negative and you act like you have no chance of transmitting the disease, you may engage in risky behaviors that's going to spread it. And that's exactly what happened in the White House, where they did use that rapid test that's now being used in Alberta. So it goes to show you that what we do need is a strategy that can make our government happy, that we're acting safe for our community, and make travelers more confident in returning to travel. And that's not just testing. That does involve other things like contact tracing and isolation.
If I could jump in, Warren, quickly and just say I agree with what Dr. Lockwood says. But even on the testing side alone, there are complications. As an example, I just checked recently about a trip to Hawaii. I thought I'd taken a little sun down there. Well, then down in Hawaii, antigen tests aren't allowed. Antibody tests aren't allowed. It's got to be a NAT test to get into Hawaii down there. And it's got to be given by an accredited facility. So I agree, and I think the Alberta initiative is a good one, but this doesn't revolve purely around testing. Let me put it that way. There are a number of other elements that need to be considered. And no, I wouldn't run around on the beach without a mask just because you had your test. Just FYI.
Agreed. Mira, Paul, would you like to add to this?
Well, I'll just add really quickly, the contact tracing apps and the different digital tools are excellent. And we know that in countries, South Korea would be a very good example, or, in other parts of the world, it can be very effective. I would say that we cannot rely on it in our market, at least in the North American market. There aren't enough users. And so that network effect is required in order for it to be useful. However, for those that are using it, there is some utility to it. I would encourage people to do it. But I would say that, agreeing with, the doctor and others, there's several strategies that we'll have to layer in. It's no one thing. But I would, just say that, the digital apps, I think, have the potential. I think that we may want to look to that in the future, because at least now people have experience, they're aware of it. But at this time, the usage is just not good enough. However, if you were to use it in a closed environment, making it a requirement at a closed workplace, at a particular hospitality site, so a resort, there would be a lot of utility. If you were to use that on a cruise ship, I think it would be extremely helpful. And or if you had some way to require people to use it, such as at a workplace environment. But otherwise, unfortunately, not enough people have been downloading it.
John, would you like to, I know we spoke a bit about contact tracing while we're on that theme, and then would you like to add to that?
Yeah, to a certain extent, yeah, we kind of know that subject relatively well in-house here. It's not common knowledge out in the market. It will be by the end of the week, but we are now working with the government of Quebec, with various regions here in the province of Quebec, on contact tracing, okay? And trust me, as Mira rightfully mentions, this is no picnic. This is no, especially in the public realm, it's one thing to contact trace everybody that's been on a flight with you. Okay, you know the names, you know the addresses, you know the contact information. It's a completely different thing to kind of get that information out of Joe Consumer. Where was he last night? Who did he meet last night? Are they willing to provide you with the information to begin with? And there's got to be an establishment of trust there, et cetera, et cetera. Contact tracing is not as, even with apps, it's not as easy as it might sound. Amira nailed that dead on, sort of thing. It is helpful. It's great when people use the apps. It's great when people participate. But in North America, that's not really the case right now.
Okay. Thank you. I want to step back a bit and sort of just look at the simple cycle of the travel insurance process, looking at sales, assistance, and claims. And if we stick sort of in the sales environment right now, and how technology can play a role, I want to know, how does the insurer prepare for the issuance of coverage and also prepare the customer for travel? Like in this sort of new order of information constantly changing and destinations also changing. John, how do I start with you again?
Yeah, boy, communication is key on this. And I believe Paul mentioned a number of very valid points here. There are a number of questions in the mind of the consumer, a number of if or am I covered, and how am I covered, and what happens when this happens, or what happens when that happens. I think communicating with the consumer is key. I also think the consumer needs to be extremely well informed. We see, we manage so many international policies from around the world, and we see special COVID policies, as an example, that have a $200,000 max. I'm sure the good doctor would confirm a $200,000 max. Sorry, I'm sure the good doctor would confirm that $200,000 in the city of Miami for ECMO treatment, because you are an at-risk patient, gets you about nowhere. Okay. Here you're talking, if it's ECMO treatment over a period of time down in Miami, you're in the millions of dollars for coverage on that. And so I think the consumer needs to be informed, and I think it's the responsibility of the insurer to come up with valid products that offer legitimate coverage in these times. That would be my opinion on that.
That's good. Paul, is there anything you might want to add since you were referenced in this?
Yeah, I think it's, look, and it's not just travel insurance, but a lot of different insurance lines.
Yeah.
Over COVID-19, business interruption is something that we do, we're building it out at the moment. It really has, COVID-19 has shone a light on, a lot of people had no idea what their policies covered. And this type of event, this massive event has shone a light on the fact that people just bought it, and people buy it 2 days out from travel and then realize what their cover is when they go to claim. And it just happened it's at such a huge scale. It's a major issue, and how we communicate to customers prior to the sale of the product and getting on the flight, and even certain, we see internationally with a lot of different partners how different types of COVID specific products, they have to be very changeable, because the jigsaw pieces are changing all the time. So it's a real challenge, but it's a massive opportunity for the industry to change how they communicate with customers, to ensure that the customer really know what they're signing up to, so it's not a surprise when a claim happens. Yep. Sorry, John.
Paul, could I ask you a question? Sorry to jump in, Warren,
Please
but
do.
Paul, could I ask you a question? How do you think the potential introduction of the new ISO standard regarding travel risk management that's due to be introduced in the first quarter of next year, to be honest, I think it's ISO 31030. How do you think that is going to impact the industry, given that it's coming out with a complete duty of care component, and one of the elements in there is pandemics?
I don't know. We work in lots of different markets. I'm not particularly aware of that particular ISO. We know ISO, obviously, but in terms of duty of care, I think in general, with all the different insurance lines that we work at in the parametric space, I think it's a relatively straightforward approach that we have. The insurance cover needs to be just blindingly simple for the consumer. That's the most important thing, and that there's no surprises after the fact. Now, we deal primarily with technology and data, so and parametric insurance can never solve the overall the total insurance problem, but it can certainly solve elements of it, and that's what our partners use us for. And we typically do hybrid solutions where parametric, our job is to get real-time data and money to people and resolutions really, really quickly. And then the traditional indemnity comes in. So that duty of care it should be there all the time, obviously, but it's so important, because I think if people don't have the ability to buy an insurance policy to give them that peace of mind, to the very first question on the panel, I think people, once they get over that public health concern about themselves and their family, they simply, I would argue, they won't get on planes. So there's an opportunity to fix the problem, but it's there to be done.
Agreed. Mira, I want to ask, are there any specific tools that you would think, just in terms of the pre-trip planning process, that the consumer can use, or that the insurer should be funneling to the traveler?
Well, I think, John mentioned a bit earlier around navigating the individual to different resources. I think that's really important. Obviously, I come from a business that would help navigate and make, complex situations, simplified, and give people access, very quick access to resources wherever they are, mostly focusing in Canada, but, many of the companies listening today and the individuals do that worldwide. And I did want to mention something about policy design. Maybe we'll talk about it later, that Paul talked a lot about that's going to be really critical about rethinking the policy design. But if I just sort of take your question and look at a tool that's really emerged as a digital health innovation that has been here for some time, and that would be the telehealth visit or the virtual consult. I think that's a really key winner out of COVID. And I know that Dr. Lockwood may disagree in some sense, because I know that, you know, he practices emergency medicine, but it's not always it's not ideal to meet patients virtually, but it's a wonderful tool to have in the tool set for physicians. And what we're seeing now is this opportunity to do this. We've got the security apparatus, we've got the trust apparatus. There's no new technology that's required. It's been here for some time. It's a matter of implementing it so that you can ensure privacy and security, so that you can ensure that you have the appropriate identity of the individual. So we've seen that as a clear winner out of COVID, just in terms of that technology being something that consumers are open to using, and they see that as quite convenient. If they've tried it during this time, they're open to it, and they may be open to use that overseas. And that's a huge opportunity for organizations that are looking to assist someone who's stuck overseas, and to manage costs in an appropriate way. I mean, there are even wonderful pilots, and we can dig a little deeper, but in terms of, you know, if someone has a live connection with your medical team back in Canada, can you talk to the ambulance team? Can you direct that individual to the correct hospital, or provide direct medical advice to the paramedic team that is attending to someone in another country? So I think the technology is there to do that. It's a matter of, we need to learn more about that. We need these types of tools and technologies here in our own healthcare system, but imagine what you know, we can do in assisting a Canadian and who's overseas, who's in a situation, whether that's you know, helping them at a really critical moment, or even directing someone away from the emergency room when it's not appropriate. They're still in their hotel room, and there's that decision, and they're on the precipice of getting into a very expensive medical event where they didn't necessarily need to proceed to the most expensive place and you know, run up a variety of different interventions that may not have been to their may not have been needed at that time.
I definitely agree with that. You know, I think that a lot of us right now carry that technology on our watches, and that's something that I think we need to do. Is, for instance, the iWatch, the Apple Watch you have there will tell you your blood oxygen level. And, you know, as an example, if you did have COVID and were holed up in a hotel somewhere in Jamaica, and you really did want to avoid the emergency for an abundance of risk, really the information you need is right there. And those are the types of things I think we also can help with our customers, is giving them that advice, because you're right, I definitely agree with you that this has shown us that there's a lot more we can do virtually and online, and those solutions already do exist. We just need to implement them.
Thank you. I think, I mean, that's a very good segue to just the assistance process and helping the person at destination, and talking about telehealth and virtual care is big on the agenda. How do we get, I mean, so if even when the insurance company adopts it, how do we get the customer to trust it? So even if they have the technology on their watch and they have the phone, but how do we get them to feel comfortable to say, well, I rely on this, as opposed to running out of the hotel or the villa to adopt it? I might actually, Dr. Lockwood, I'll throw that back to you before going back around the room.
Well, I mean, I think one thing is, you know, the patient customer or patient physician relationship or other healthcare provider, is that showing that you have a lot of experience in this, and that this is something that's come up. And, you know, more and more as people do travel, more people that have respiratory illnesses are probably going to call for advice, and having procedures and policies about that, and being able to, you know, have good local knowledge of what's available is going to be helpful. Now more than ever, I think people are avoiding healthcare situations that they feel are dangerous, and those tend to be more expensive things. And I agree again with Mira that sometimes they're not warranted, and there is an opportunity there if companies do have good relationships with their customers, where they can give them good medical advice, which will provide them with the most appropriate care, and that sometimes is more cost effective too.
John, I know that we've spoken about this aspect as well.
Yeah, well, on that one right there, you're kind of preaching to the converted. We've been running telemedicine and virtual physicians for well over 5 years now, and to be honest, part of this, Mira, goes to what you mentioned there in regard to policy wording, having the patient call in advance. And statistically, we can prove it. We've got clients that have over 70, almost 80% acceptance of telehealth, or visiting physicians is the other big one that we push, okay? Instead of Warren talking to a doctor on the cell phone on the beach down in Jamaica down there, we'll send in a doctor to your hotel down there or to your home wherever you are in the world. And the take up on this, like I say, we have clients that are running at 70, 80%. The cost savings, I don't want to Mira mentioned it, how costly these unnecessary interventions can be. The cost savings are simply massive, okay? More than the cost though, it's about the customer journey and the convenience to the customer. And I remember very, very well, you know, a well-known person in the Canadian market here saying how she had been to a resort down in Mexico and had called into our Standby MD product. I don't want to, shouldn't be mentioning it by name, but, and how convenient it was that we sent a doctor over to her hotel to take care of her, and how much, so much better that was than having to go out into the community and kind of find, or, you know, find a clinic or rely on the front desk, okay, of a facility down there, who undoubtedly is getting paid money by a clinic to direct people in there. And all of a sudden you're landing at a clinic down in Puerto Vallarta, and you've got yourself a $100,000 bill and your appendix is missing for no particular reason, if you know what I mean. I'm exaggerating here, of course, but I think Mira mentioned it, this whole concept around steerage, direction, getting the people the right care, the right time, at the right place, and at the right cost. I think cost should be at the end there, but I think it's about the customer journey again.
Yeah. I think it's interesting, Warren. I think it's, you know, when we see a lot of insurance companies, they tend to get a lot of information, and they get a huge amount of information, and they just give it to the customer, who will never read it, who will never ingest it. It's all about, to John's point, that customer journey. You know, because this is only a small part of people's lives. You know, their travel insurance, they're traveling, they've got everything going on. It's giving contextualized information in real time when they need it. And you have to build that journey, to Dr. Lockwood's point about integrating with your Apple Watch, so you can actually see when that oxygen blood level is changing, and you can provide contextualized information at that point in time. So, or knowing where your insured party is at any point in time. They're in Mexico, or they're in Ireland, or whatever that is. So you can, instead of giving them a 50-page PDF that nobody will ever read. So it's, you know, the days of encouraging somebody to download an app, having done this for years, it's almost impossible to get somebody to download an app, and it's even worse to get them to keep it. So we don't do that. So we do things in a different way. So, and I think I would encourage, definitely not a medical professional by any stretch, but providing information at the right time contextually, and then using the technology. So there's fantastic stuff that we see all the time, telehealth and using IoT and wearables, etc. It's really interesting, and that's where it should be going. But it gives the opportunity to completely change that customer journey and those customer pinch points, if you like.
I very much agree. And I think the question for me, in keeping the technology perspective, is, you know, what should insurers now be thinking about in terms of integrating that? Because I still think that there's a bit of complacency, but we have to recognize, like, I mean, the previous summit was all about, you know, prepare for disruption. We're beyond this. We're beyond disrupted. We're shattered. And as we adapt to a market that's quite agile, how should people now be looking at how to integrate technology or consider test and experiment?
Yeah, I mean, sorry to jump into, but like if you look at, I'd step back from our industry and look at other parts of your life. I mean, your Netflix or your Uber, or different parts of your life where your expectation is the same thing. I want to have what I want. I want it when I want it. I want it priced really aggressively. You know, that's what I expect. I don't want any paper. It has to be completely digital. And that's going to become table stakes. in everything. And if you don't provide that level of service, you're literally waiting for somebody to come along and offer a product that does it, and it's going to impact your business severely. So it's, and how you put together these solutions, it's not about building it all yourself. You know, there's lots of different services, you know, to the iPhone, to, you know, who would ever build that again? There's API, microservices, sorry, there's all these technology buzzwords, but you can build these solutions relatively quickly. I mean, we're in the Lloyd's lab, we're building out a solution in business interruption in 8 weeks, because you take a certain approach to things. So I think typically insurers have lots of resources, lots of very smart people, and it's the cultural approach to building product. Yeah, so that'll be our startup mentality anyway.
That's good. I also want to, I mean, in the interest of time, just step to a different perspective within the assistance context, but also look at, you know, the side of operations. So the heartbeat of the industry, which are the people in the assistance centers, in the claims department, who are having to navigate this and working perhaps with trying to get a Canadian from a destination that's you know, already at capacity, repatriating them home to a health system that is also at capacity. Like, what are the things that we should be thinking about in terms of preparing the workspace and tools, and just keeping our team, our heartbeat, safe? Dr. Lockwood, I might jump to you there and then go back around.
I might pass on that. I'm not sure. I think the others might answer that a bit better. With purely a medical background, I'm not sure I'm the most qualified.
And if, Mira?
I feel like I beat the horse up there a little bit, you know, in terms of, you know, please be digital, use these technologies that are there, absorb them. If you build it, they will come. And I did just want to, you know, touch back to what Paul said in terms of, yes, you know, experiment and, you know, integrate these technologies. You know, in 8 weeks, they can build something. Yes, that's what's happening. I mean, what we're seeing right now in digital health technology startups is no shortage of funding at this time during COVID. We're seeing quite a robust InsurTech, you know, ecosystem that's been raging on. And I think you all have been exposed to a lot of those messages over and over, and this is a matter of what to do. But I mean, I think it goes down to sort of the fundamental level, which is why is any business doing things in the same way that they have been doing it before? How well has your business been responding to what's happening out there? And this COVID might be an opportunity to rethink things and to conduct these small experiments in terms of, we're going to take a team aside and try another way of providing assistance and going back to that core team and how they can deliver and optimize that experience. And you know, it really goes down to, how is the business model going to be different? Yes, coming into you know, on the sales side and the policy, we're going to have policy personalization to a higher degree. Organizations are doing that. There are startups that are out there. So, you know, in terms of, you know, the last speaker talking about blockchain and all the different tools that you have out there, you know, think in terms of not the way we have been doing things, but the way that things will be happening. How can we optimize it? You know, how would your organization respond to behavioral premium pricing? You know, what if there were tools and there were consumers that are willing to do that? So that usage-based insurance. I mean, that's sort of antithetical to some of the ways that you know, travel health policy and protection is offered today. But if you think about that, you know, that might be a better way to reframe the thinking about how to respond to the current crisis, by almost thinking, how is it going to be disrupted? What will change when consumers are coming back to travel? What will they be looking for? They will be reading policies now. They will want that clear information. They are going to be reading the fine print. So all of those things, provide somewhat of an opportunity to provide that audit of where are we, how are we responding to the current challenges, and where will we be positioned for the changes to come. So I wanted to push that back to everyone. It's a bit of a meaty challenge, but I see that there's a lot of opportunity there as well.
No, I think we all agree. I saw everyone's head nodding, and I mean, it's sort of that element that you spoke about, where it's like, people are going to expect their healthcare to be just like an app. It's instant customer service, and they want to get that. And also in terms of building technology, gone are the days where you'd have the team and they'd build, you'd build out your own system. It's almost like, plug and play now. This is what's working now. If somebody has that, we'll plug this in. It has to adapt. We have to adapt. And again, to your point, very much consumers do understand the value of travel insurance, and we're going to have to continue to deliver that value and adapt as the world is. With just 9 minutes to go, we cannot go to audience questions yet without touching on claims. And Paul, I definitely know that this is very much an area for you, but I just want to think about, both for the assistant staff, or especially for the claim staff, in moving to paperless and having everything more electronic now, how do we trust that the medical records and the claims being made are not fraudulent, that they're safe?
Yeah, I mean, what we don't do medical records. The part that we do is flight disruption, delay. So it's, I think it's interesting if you look at the claim staff. I think obviously with COVID, they would have been under humongous pressure, and I think it's all about using technology as a volume button. For our particular solution, it's completely automated, so there is no TPA involved whatsoever. In terms of, so we build parametric products around pieces of data. Now, whether it's flight delay or cancellation, in time to come, health records could be that trigger for the payout, for example. So there's an interesting, we typically do high frequency, low severities when it's very, very expensive to process a claim. To pay out a relatively small claim, it may make sense to automate that. So the fraudulent piece, we have to consider that as well. There's cases in China where people were buying parametric insurance products and basically betting on weather, delaying flights. So you've got to build in your safeguards around that, because you're paying out that money and claims in real time. For example, we're integrated with Interact, so we get money to people really, really quickly. So to do that, you've got to have really robust systems, so fraud is heavily mitigated. So it's a very interesting space, and it's really interesting to see what the consumers are expecting over time. They get very used to real-time resolution of problems and not waiting for months on end to get claims paid. So I think that is the moment of truth with all insurance. And that's where parametric, we think, plays a part in solving some of these issues.
Definitely. John, would you like to add anything on that?
Yeah, well, claims processing is something we know a fair bit about. I think in a typical year, we'll process about $2 billion worth of US claims running through the system. And yes, there is fraud, and we rely heavily on technology in the recognition or the finding of fraud there, but there's also a very much a human element as well, that as the claim flows through the system. Naturally, one of the realizations this year, of course, was non-medical claims. We got more non-medical claims in the month of March than we would typically get in an entire year. And as Paul mentioned there, we worked together with our clients, the insurers, on quick claim processing. This was a big issue for us in March, April, May sort of thing, just getting this massive volume of claims through the system. But as Paul mentioned, these are high volume, low dollar value claims. The scary ones are the big medical ones. And Warren, you want to buy yourself a what looks like a legitimate hospital bill on the beach in Jamaica, you let me know and I'll give you the names of a couple of people you can go to down there. The bills look completely legitimate, okay? And they're sent into, you know, into somebody like us, and we've got to audit them. We've got to make sure that it's a legitimate claim, that the medical provider was a legitimate medical provider. Fraud is rampant, and God in heaven knows that anybody dealing with the claims in the USA, if you're not running bill editing stuff on that, if you're not running your checks and balances on those claims, I can guarantee you're overpaying. But as Paul mentioned, there is a what's known on the insurance side, okay? Not that we use it, but what's known on the insurance side is a leakage factor. How much am I willing to leak in unnecessarily paid claims versus what am I paying to adjudicate those claims or process those claims? And I think, Paul, you'd agree on certainly on the trip can, you know, baggage, all those sorts of claims. There is a trade-off there. Okay, and typically insurers come to us and say our leakage, this is an acceptable leakage rate to us, and we need to report back what these leakage rates are. So it's claims, no question, important. Technology to support your adjudication of those claims, absolutely vital. You can't do it otherwise. And you've got to be running the latest technology, and we're running AI technology in those claims adjudication processes that we do in-house.
Thank you, John. Listen, I know we're running out of time, and I want to get to the audience questions. Mira, I know Mira has a comment, but I'm going to see if she can work it into her question. Otherwise, I encourage everyone to connect with our panel of the four wise people here. And also, please make sure you're answering the polls in the mealtime. Will, do you have any questions from the audience?
Yeah, there are a number of questions. Not sure we have a great deal of time, but there's certainly some discussion around, you know, whether or not the amount of the products that have hit the market early stages are enough to satisfy the need and the risk for an individual should they get significantly sick while they're away. Sort of throw that out to the team, whether there are any thoughts about that.
From my point of view, I mentioned it earlier, buyer beware. Know what you're purchasing. Know what you're covered for. Know what the benefits are. Know your own particular risk rating. Am I 80 years old, and could I be subject to a long-term hospital stay? Know what you're buying is my advice to Joe consumer out there. And for the insurers, be clear in what you're selling.
Thank you.
Joel, I think you were going to weigh in on that too.
You know, I can't agree with John anymore that if you get sick with COVID, it's not something that's going to cost 20 or 40 thousands of dollars. It's going to cost hundreds to millions, certainly. You know, you will be sick for a number of weeks in an ICU. You will be getting every test known to man. And under such crazy and stressful times, the last thing you want to be worrying about is not having enough cover. So that is of the utmost importance is if you do choose to travel, to know what exactly coverage you have.
So in a strange way, it's taken a pandemic for us to really get our message across, which is know your health, know your policy, know your trip, and again, know your rights.
I think unfortunately, just to keep it on time, I'll encourage you to connect with each panelist directly. They'll be in the chat, they'll be participating in the session. We're also going to be sharing their contact information with you in the summit follow-up, and they're also on LinkedIn. I'm sorry that we didn't get to even more questions, but this was fantastic. It's just the tip of the iceberg, but there's opportunity. Thank you all so much.
Panel, thanks so much for your participation today. Super helpful, great content, great information. For those of you who are participating and looking at the chat, get in on those polls. You'll see the results when you actually click through and enter the results. Still kind of surprised that only 50% within the industry, where we're starting to see it's important that we understand the risks, are downloading and sharing that content through the government tracing app. So maybe that's something we need to do, certainly something for us to think about. As we move over to networking, we'll be back at 10 minutes past the hour. Thanks, everyone.
Thank you.
Thank you.